Nocturia and heart health for seniors. Have you ever wondered why you're getting up 2, 3, or even 4 times a night to use the bathroom? You might think it's just a normal part of getting older, maybe just your bladder acting up, or perhaps you had too much water before bed. But what if I told you that waking up multiple times at night to urinate could be your heart sending you a desperate warning signal? What if those nighttime bathroom trips aren't just annoying interruptions to your sleep, but actually a red flag that your heart is struggling to do its job? Today, we're going to dive deep into something that affects millions of Americans over 60, yet hardly anyone talks about the surprising and critical connection between frequent nighttime urination and heart failure. This isn't just about inconvenience or lost sleep. This is about understanding a symptom that could literally save your life. Let me start by sharing something that might shock you. According to recent medical research, if you're waking up more than once per night to urinate, a condition doctors call nocturia, you could be at significantly higher risk for heart problems than you realize. Now, before you panic, let me be clear that not everyone who experiences nocturia has heart failure. There are many reasons why people wake up at night to use the bathroom, and we'll explore all of them today. But what's crucial to understand is that nocturia can be an early warning sign of cardiac issues, and recognizing this connection early can make all the difference in your health outcomes. The relationship between your heart and your kidneys is far more interconnected than most people realize, and when your heart isn't pumping efficiently, it creates a cascade of effects throughout your entire body, including how and when your kidneys process fluid. So what exactly is nocturia, and why should you care? Nocturia is the medical term for waking up 1 or more times during the night because you need to urinate. Now, you might be thinking, well, I wake up once a night, is that a problem? Generally speaking, waking up once per night is considered relatively normal, especially as we age. Our bladder capacity decreases slightly, our sleep becomes lighter, and various age-related changes make that single nighttime trip fairly common. However, when you're consistently waking up 2 or more times per night to urinate, that's when doctors start paying closer attention. And when it's 3 or more times, that's definitely something that warrants investigation. The key word here is consistently. We're not talking about that one night when you had 3 glasses of water right before bed, or when you consumed a lot of caffeine in the evening. We're talking about a pattern that persists night after night, week after week. Now let's talk about why this happens and how it connects to your heart. Your heart is essentially a pump, and its job is to circulate blood throughout your entire body efficiently. When your heart is healthy and strong, it pumps blood effectively during the day while you're active and upright. This efficient pumping means your kidneys receive adequate blood flow throughout the day, allowing them to filter your blood and produce urine in a relatively steady, normal pattern. However, when your heart begins to weaken or fail to pump effectively, a condition we call heart failure or congestive heart failure, everything changes. During the day, when you're standing or sitting upright, gravity causes fluid to pool in your lower extremities. You might notice this as swelling in your ankles or feet by the end of the day. This happens because your weakened heart isn't pumping blood back up from your legs as efficiently as it should. That pooled fluid isn't being properly circulated through your kidneys for filtering, so it just sits there in your tissues. But here's where it gets interesting and where the nighttime urination comes in. When you lie down to sleep at night, gravity is no longer pulling all that fluid down into your legs. Suddenly, all that fluid that's been pooling in your lower body throughout the day starts to redistribute back into your circulation. Your heart, even though it's weakened, now has access to all this extra fluid. Your kidneys finally get the blood flow they need, and they go into overdrive trying to filter all this excess fluid out of your system. The result? Your bladder fills up quickly and repeatedly throughout the night, waking you up again and again to urinate. It's your body's way of trying to get rid of all that excess fluid that accumulated during the day because your heart wasn't strong enough to circulate it properly. In essence, your kidneys are working the night shift because your heart couldn't handle the day shift. This is why cardiologists and heart failure specialists pay such close attention to nocturia. It's not just a urinary symptom, it's a cardiovascular symptom. When a patient comes in complaining about waking up multiple times at night to urinate, especially if they're in the age range where heart disease becomes more common, it immediately raises red flags. Doctors will start asking other questions too. Are you experiencing shortness of breath, especially when lying flat? Do you get winded easily when climbing stairs? Have you noticed swelling in your ankles or legs? Are you feeling more fatigued than usual? Do you sometimes feel like your heart is racing or beating irregularly? All of these symptoms, combined with nocturia, paint a picture of potential heart failure that needs immediate attention. Now, I want to emphasize something really important here. Heart failure doesn't mean your heart has stopped working or is about to stop. The term can be frightening, but what it actually means is that your heart isn't pumping as efficiently as it should. It's not meeting your body's demands for blood and oxygen. Heart failure is a chronic condition that can be managed, treated, and in many cases, significantly improved with the right medical care, lifestyle changes, and medications. The key is catching it early, and that's exactly why recognizing symptoms like nocturia is so critical. The earlier heart failure is detected, the better the outcomes and the more options you have for treatment. Let me explain a bit more about how heart failure develops, because understanding this will help you appreciate why that nighttime urination is such an important signal. Heart failure typically develops over time, often as a result of other conditions that damage or overwork your heart. High blood pressure, which affects about half of American adults, forces your heart to work harder to pump blood against increased resistance in your arteries. Over years and decades, this extra work can weaken your heart muscle. Coronary artery disease, where the arteries that supply blood to your heart muscle become narrowed or blocked, can damage your heart tissue, especially if you've had a heart attack. Diabetes, which is increasingly common as we age, can damage blood vessels and nerves that control your heart. Previous heart attacks leave scar tissue that can't contract like healthy heart muscle, reducing your heart's pumping efficiency. Even things like sleep apnea, which is very common in older adults, can strain your heart over time by repeatedly depriving it of oxygen during sleep. The symptoms of heart failure often develop gradually, which is one reason why it can be missed or attributed to just getting older. You might start feeling a little more tired, a little more short of breath when climbing stairs, but you chalk it up to age or being out of shape. Maybe your ankles swell by the end of the day, but you think it's just from being on your feet. You start waking up at night to urinate, but you assume it's just your prostate or your bladder getting older. Each symptom alone might seem minor or explainable, but when you put them all together, they tell a very different story. This is why it's so important to pay attention to patterns and changes in your body, especially as you get older. Your body is constantly communicating with you, and symptoms like nocturia are part of that communication. Now, I don't want you to think that every case of nighttime urination means you have heart failure, because that's definitely not true. There are many other conditions and factors that can cause nocturia, and it's important to understand these as well. For men, an enlarged prostate is one of the most common causes of nighttime urination. The prostate gland surrounds the urethra, and as it enlarges with age, which happens to most men, it can press on the urethra and make it harder to empty your bladder completely. This means your bladder fills up again more quickly, leading to more frequent urination, including at night. For women, weakened pelvic floor muscles after childbirth or menopause can contribute to urinary frequency. Overactive bladder syndrome, which can affect anyone regardless of gender, causes sudden, strong urges to urinate that can wake you from sleep. Urinary tract infections, while more common in women, can cause frequent painful urination at any time of day or night. Diabetes, both type 1 and type 2, causes increased urination as your body tries to eliminate excess sugar through your urine. Sleep disorders like sleep apnea can disrupt your normal hormones that regulate urine production at night. Even certain medications, particularly diuretics that are ironically often prescribed for heart conditions or high blood pressure, can cause increased nighttime urination if taken too late in the day. So how do you know if your nocturia is related to heart failure or one of these other conditions? This is where paying attention to the full picture of your symptoms becomes crucial. Heart failure-related nocturia typically comes with other telltale signs. One of the most significant is orthopnea, which is the medical term for shortness of breath when lying flat. If you find yourself needing to prop yourself up with multiple pillows to sleep comfortably, or if you wake up feeling like you can't breathe and need to sit up, that's a classic sign of heart failure. This happens because when you lie flat, fluid that's accumulated in your body due to poor circulation can shift toward your lungs, making it harder to breathe. Another related symptom is paroxysmal nocturnal dyspnea, a frightening condition where you suddenly wake up gasping for air, usually 1 to 2 hours after falling asleep. This happens when fluid builds up in your lungs while you're sleeping. You might also notice a persistent cough, especially when lying down, sometimes producing white or pink-tinged phlegm, which is another sign of fluid in your lungs. Swelling or edema is another key indicator. With heart failure, you'll typically see swelling in your ankles, feet, and legs, and it's usually worse at the end of the day after you've been upright. You might notice that your shoes feel tight by evening, or that pressing on your shin leaves an indentation that takes a while to bounce back. In more advanced cases, you might notice swelling in your abdomen or even rapid weight gain from fluid retention, sometimes gaining 2 or 3 pounds or more in just a day or two. Fatigue is another common companion to heart failure-related nocturia. This isn't just normal tiredness from a busy day, this is a profound exhaustion where simple activities like walking to the mailbox or doing light housework leave you feeling completely drained. You might find yourself needing to rest frequently or giving up activities you used to enjoy because you just don't have the energy anymore. Your heart isn't pumping enough oxygen-rich blood to your muscles and organs, leaving them energy-starved. If you're experiencing nocturia along with any combination of these other symptoms, it's absolutely critical that you see your doctor as soon as possible. Don't wait for your next scheduled checkup. Make an appointment specifically to discuss these concerns. When you go to your appointment, be prepared to give your doctor detailed information. How many times per night are you typically waking up to urinate? How long has this been going on? How much are you urinating each time? A lot or just a little? What other symptoms are you experiencing? Have you noticed any patterns or things that make it better or worse? This information will help your doctor determine what tests are needed to get to the root of the problem. Your doctor will likely start with a thorough physical examination, listening to your heart and lungs, checking for swelling, measuring your blood pressure and heart rate. They'll probably order some blood tests to check your kidney function, electrolyte levels, and something called BNP, or brain natriuretic peptide, which is a hormone your heart releases when it's under stress. Elevated BNP levels are a strong indicator of heart failure. You might also get an electrocardiogram or EKG, which records your heart's electrical activity and can detect irregularities in rhythm or signs of previous heart damage. An echocardiogram, which is an ultrasound of your heart, is one of the most important tests for diagnosing heart failure. It shows how well your heart is pumping, measured by something called ejection fraction, and can reveal problems with your heart valves or chamber sizes. A chest X-ray can show if there's fluid in your lungs or if your heart is enlarged. Depending on these initial findings, your doctor might order additional tests like a stress test, cardiac catheterization, or other specialized imaging. If you are diagnosed with heart failure, the good news is that there are many effective treatments available today that can significantly improve your quality of life and prognosis. Treatment typically involves a combination of medications, lifestyle changes, and in some cases, medical devices or procedures. Medications for heart failure have improved dramatically over the past few decades. ACE inhibitors, or ARBs, help relax your blood vessels, making it easier for your heart to pump. Beta blockers slow your heart rate and reduce blood pressure, giving your heart a chance to rest and recover. Diuretics, often called water pills, help your body eliminate excess fluid, which can reduce swelling and ease breathing, though they need to be carefully timed so they don't contribute to nighttime urination. Newer medications like SGLT2 inhibitors, originally developed for diabetes, have shown remarkable benefits in heart failure patients. Your doctor will work with you to find the right combination of medications for your specific situation. Lifestyle changes are equally important and can make a tremendous difference in managing heart failure. Dietary modifications are crucial, particularly limiting sodium intake. Excess sodium causes your body to retain fluid, which is exactly what you're trying to avoid with heart failure. Most Americans consume far too much sodium, often without realizing it, because it's hidden in processed foods, restaurant meals, and even foods that don't taste particularly salty. Your doctor will probably recommend limiting your sodium to 1,500 to 2,000 milligrams per day, which is much less than the average American consumes. This means reading labels carefully, cooking more at home with fresh ingredients, and being cautious about condiments, canned goods, and prepared foods. You'll also need to monitor your fluid intake. While staying hydrated is important, consuming too much fluid can overburden an already struggling heart. Your doctor will give you specific guidelines about how much to drink based on your individual situation. Regular physical activity, approved by your doctor, is also beneficial for heart failure. This might seem counterintuitive when your heart is weak, but appropriate exercise actually strengthens your heart muscle and improves circulation. The key is starting slowly and gradually increasing activity under medical supervision. Even gentle walking can make a significant difference. Cardiac rehabilitation programs, which provide structured, supervised exercise along with education about heart-healthy living, can be incredibly valuable for people with heart failure. Maintaining a healthy weight reduces the workload on your heart. If you're overweight, even modest weight loss of 5 to 10 pounds can improve your symptoms. Quitting smoking if you smoke is absolutely critical, as smoking damages your blood vessels and heart. Limiting alcohol is also important, as excessive alcohol can weaken your heart muscle. Managing stress through relaxation techniques, meditation, or counseling can help because chronic stress takes a toll on your cardiovascular system. Let me also address some specific strategies for managing nocturia itself, whether it's related to heart failure or other causes, because getting better sleep is important for your overall health. Timing your fluid intake wisely can help. Try to drink most of your fluids earlier in the day and reduce intake in the 2 to 3 hours before bedtime. However, don't restrict fluids so much that you become dehydrated. Limit caffeine and alcohol, especially in the afternoon and evening, as both can increase urine production. If you're taking diuretics for heart failure or high blood pressure, talk to your doctor about the best time to take them. Taking them in the morning rather than evening can help reduce nighttime urination. Elevating your legs for a few hours in the late afternoon or early evening while you're relaxing can help mobilize fluid from your legs before bedtime, so your body processes it earlier rather than at night. Double voiding, where you urinate, wait a few moments, then try to urinate again, can help ensure your bladder is completely empty. For those with heart failure, wearing compression stockings during the day can help prevent fluid from pooling in your legs, which means less fluid to be mobilized when you lie down at night. Keeping your bedroom cool and comfortable promotes better sleep quality. Using a nightlight creates a safer environment for those nighttime trips to the bathroom, reducing fall risk. If you're waking up multiple times anyway, some people find it helpful to set an alarm to wake up and use the bathroom before their bladder wakes them naturally, as this can sometimes result in better quality sleep between trips. Keeping a bladder diary for a week or two, noting how much you drink, when you drink it, and how often you urinate, can help you and your doctor identify patterns and develop strategies. It's also worth mentioning that mental health plays an important role in managing chronic conditions like heart failure. Receiving a heart failure diagnosis can be scary and overwhelming. Many people experience anxiety or depression after being diagnosed, which is completely understandable. These emotional responses can actually make your physical symptoms worse and make it harder to stick with your treatment plan. If you're feeling anxious, depressed, or overwhelmed, please talk to your doctor. There are effective treatments available, including counseling and medication if needed. Joining a support group, either in person or online, where you can connect with others who are dealing with similar challenges can be incredibly helpful. Many people find that talking with others who truly understand what they're going through provides comfort and practical advice. The connection between sleep quality and heart health is also worth understanding. Chronic sleep disruption from nocturia or other causes doesn't just make you tired, it can actually worsen heart failure. Poor sleep increases stress hormones, raises blood pressure, promotes inflammation, and interferes with your body's ability to regulate metabolism. This creates a vicious cycle where heart failure causes nocturia, which disrupts sleep, which worsens heart failure. Breaking this cycle by addressing both the underlying heart condition and implementing strategies to improve sleep quality is essential. This might include working with a sleep specialist if you also have conditions like sleep apnea, which frequently coexist with heart failure and can make both conditions worse. Prevention is always better than treatment, so let me spend a moment talking about how to keep your heart healthy and reduce your risk of developing heart failure in the first place. Controlling high blood pressure is absolutely crucial. High blood pressure is called the silent killer because it often has no symptoms but silently damages your heart, arteries, and kidneys over years. Have your blood pressure checked regularly, and if it's elevated, work with your doctor to bring it under control through lifestyle changes and medication if needed. Managing diabetes is equally important. High blood sugar damages blood vessels throughout your body, including those feeding your heart. If you have diabetes or prediabetes, keeping your blood sugar well controlled significantly reduces your risk of heart complications. Maintaining healthy cholesterol levels prevents the buildup of plaque in your arteries that can lead to heart disease. Eating a heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats while limiting saturated fats, trans fats, and processed foods provides your body with the nutrients it needs to maintain cardiovascular health. Regular exercise is one of the best things you can do for your heart. Aim for at least 150 minutes of moderate intensity aerobic activity per week, which breaks down to just 30 minutes a day, 5 days a week. This doesn't have to be running or intense gym workouts. Brisk walking, swimming, cycling, dancing, or any activity that gets your heart rate up and makes you breathe a bit harder counts. The key is consistency and finding activities you enjoy enough to stick with long term. Maintaining a healthy weight reduces strain on your heart and lowers your risk of conditions like diabetes and high blood pressure that can lead to heart failure. Even if you've been overweight for years, losing even a modest amount of weight can provide significant health benefits. Not smoking or quitting if you do smoke is one of the single most important things you can do for your heart health. The good news is that your risk of heart disease starts decreasing almost immediately after you quit and continues to drop over time. Limiting alcohol consumption is also important for heart health. While some studies have suggested that moderate alcohol consumption might have some cardiovascular benefits, excessive drinking can weaken your heart muscle and contribute to heart failure. If you drink alcohol, do so in moderation, which means up to 1 drink per day for women and up to 2 drinks per day for men. Managing stress through healthy coping mechanisms like exercise, meditation, hobbies, social connections, or professional counseling protects your heart from the damaging effects of chronic stress hormones. Getting enough quality sleep, typically 7 to 9 hours for most adults, allows your body to repair and restore itself, including your cardiovascular system. Regular medical checkups allow your doctor to monitor your cardiovascular risk factors and catch potential problems early when they're most treatable. As we age, it's especially important to stay alert to changes in our bodies and not dismiss symptoms as just normal aging. While some changes are indeed a normal part of getting older, many symptoms that people attribute to aging are actually signs of treatable medical conditions. That's certainly true of nocturia. While some increase in nighttime urination can be normal with age, consistently waking up multiple times every night to urinate, especially if it's accompanied by other symptoms like shortness of breath, swelling, fatigue, or chest discomfort, deserves medical attention. Your body is trying to tell you something, and listening to those signals could literally save your life. I also want to emphasize the importance of being your own health advocate. You know your body better than anyone else. If something doesn't feel right, if you notice concerning changes, if symptoms are affecting your quality of life, speak up. Don't wait for your doctor to ask. Bring up your concerns. Write down your symptoms before your appointment so you don't forget anything. Bring a list of all your medications, including over-the-counter drugs and supplements. If you don't understand something your doctor says, ask them to explain it in simpler terms. If you're not comfortable with a recommendation or don't think a treatment is working, have that conversation. Good medical care is a partnership between you and your healthcare team, and you play an active role in that partnership. Family members and caregivers also play a crucial role, especially for older adults who might not notice gradual changes in their own health or who might be reluctant to seek medical care. If you're caring for an aging parent or loved one, pay attention to signs like increased nighttime urination, shortness of breath, swelling, fatigue, or changes in their ability to perform usual activities. Encourage them to see their doctor and offer to accompany them to appointments. Having another person there to ask questions and help remember information can be incredibly valuable. Keep a list of their medications and make sure they're taking them as prescribed. Help them implement heart-healthy lifestyle changes by cooking nutritious meals, encouraging appropriate physical activity, and providing emotional support. The field of cardiology is constantly advancing, with new treatments and technologies emerging regularly. Research into heart failure continues to yield promising results, from new medications that improve outcomes to innovative devices and even potential regenerative therapies. Clinical trials are ongoing, testing new approaches to treating and managing heart failure. If you have heart failure, ask your doctor whether any clinical trials might be appropriate for you. Participating in research not only gives you access to cutting-edge treatments, but also contributes to advancing medical knowledge that will help future patients. Technology is also playing an increasing role in managing chronic conditions like heart failure. Remote monitoring devices can track vital signs like weight, blood pressure, and heart rhythm, alerting your healthcare team to concerning changes before they become emergencies. Smartphone apps can help you track medications, symptoms, fluid intake, and other important health data. Telemedicine allows you to have appointments with specialists without the burden of travel, which can be especially valuable if you're not feeling well or have mobility limitations. While technology should never completely replace in-person medical care, it can be a valuable supplement that improves communication with your healthcare team and helps you manage your condition more effectively. One thing I cannot stress enough is the importance of medication adherence if you're prescribed medications for heart failure or any other condition. Studies show that many people don't take their medications as prescribed, whether because of side effects, cost, confusion about instructions, or simply forgetting. However, for conditions like heart failure, taking your medications consistently as prescribed is absolutely critical to managing your condition and preventing it from getting worse. If you're experiencing side effects, don't just stop taking your medication. Call your doctor to discuss alternatives. If cost is an issue, talk to your doctor about generic options or patient assistance programs. If you have trouble remembering to take medications, use pill organizers, set phone alarms, or ask your pharmacist about blister packaging. Whatever the obstacle, there's usually a solution, but you have to communicate with your healthcare team so they can help you. Let's circle back to where we started with that seemingly simple symptom of waking up multiple times at night to urinate. What I hope you understand now is that this isn't necessarily just an annoying part of getting older or a simple bladder issue. Your body is an interconnected system where problems in one area can manifest as symptoms in another. That nighttime urination could be your heart's way of calling for help, signaling that it's not able to circulate blood and fluids effectively during the day. The kidneys then work overtime at night to process accumulated fluid, filling your bladder repeatedly and disrupting the restorative sleep you need. Recognizing this connection and understanding that nocturia combined with other symptoms like shortness of breath, swelling, or fatigue could indicate heart failure empowers you to seek medical attention early when treatment is most effective. Early detection and treatment of heart failure can literally add years to your life and significantly improve the quality of those years. Heart failure doesn't have to be a death sentence. With proper medical care, medication, lifestyle modifications, and self-monitoring, many people with heart failure live active, fulfilling lives for many years. The key is catching it early, following your treatment plan consistently, staying in close communication with your healthcare team, and making heart-healthy choices every day. Every medication you take as prescribed, every healthy meal you eat, every walk you take, every cigarette you don't smoke, and every doctor's appointment you keep is an investment in your health and your future. If there's one message I want you to take away from this video, it's this. Pay attention to your body's signals, especially changes in patterns like increased nighttime urination. Don't dismiss symptoms as just aging or something you have to live with. Advocate for your health by bringing concerns to your doctor. If you're experiencing nocturia along with other symptoms we've discussed today, make an appointment to get evaluated. A simple conversation with your doctor, followed by some basic tests, could identify a serious problem that's highly treatable when caught early. On the other hand, if everything checks out fine, you'll have peace of mind knowing that your symptoms are due to something less serious. Either way, you win by being proactive about your health. Your heart works tirelessly every moment of every day, beating about 100,000 times and pumping about 2,000 gallons of blood through your body. It deserves your attention and care. By understanding the warning signs like nocturia and taking action when needed, you're giving your heart the support it needs to keep you healthy and active for years to come. Remember, age is just a number, and with the right care and attention, your 60s, 70s, 80s, and beyond can be vibrant, active, fulfilling years filled with the people and activities you love. Thank you so much for watching this video today. If you found this information helpful and want to learn more about heart health, senior wellness, and other important health topics for people over 60, please subscribe to Senior Soul Care. Hit that notification bell so you never miss our videos packed with practical, life-saving information designed specifically for you. Share this video with your friends and family members who might benefit from understanding the connection between nighttime urination and heart health. Leave a comment below telling us about your experiences or questions you'd like us to address in future videos. Your engagement helps us create the content that matters most to you. Together, we're building a community of informed, empowered seniors who are taking charge of their health and living their best lives. Until next time, take care of your heart, and it will take care of you.